Hey everybody, how you doing? Uncle Vinny here. You know what's coming up? That's right, Health Chat. Grab a cup of coffee, sit back, relax, and enjoy the show.
You're listening to Health Chat. I'm Dr. Nick Circolone. I'm hanging out. Look how good I look. Do I not look good? You know why I look so good? Look how pretty she is. It makes me look good. Well, you know, first time I've had a guest in the studio. I mean, she came into the house, comes into the studio, like she owns the place. I don't understand. She just comes in here. This is Actually, it's Ryan Danielle Miller. I can't even get it right. How did I screw that up? I mean, I have no idea how I screwed it up. It's like the first time I met this girl, right? I don't even know what's going on here. So Danielle is with us. You know, only her friends and family can call her Danielle, I think, right? Isn't that the way it goes? So Danielle is a marriage and family therapist, and she's working really hard at getting back into the game. So she's going to be on with me. And you can get closer to me. I don't bite. Trust me. No, so you get really close and just like, hey, going on. All right, guys. I have to tell you, this is my daughter. So just relax. I'm not hugging on pretty women. Just hug on pretty women. But she's my daughter, which is okay. That's all right. So, but Danielle is actually a marriage and family therapist. We're talking a little bit about marriage and family therapy, but not just marriage and family therapy, because she's not just a therapist for marriage and family, but she's a therapist. She does play therapy. She's talking about doing now with postpartum, right?
Yeah.
You know, I never suffered from postpartum. She's going to giggle the whole show. I can tell. So, you know, this is kind of fun to do. Get closer. It's okay. You know, you're going to get in the street. People want to see you. They want to see. Look how pretty she is.
Oh my
goodness. So, Joe, can you believe that she's on here? She's going to giggle the whole time. You know that, right?
Well, you're a funny guy, so I get it.
Yeah, I know.
Crazy.
I know. It's just y'all crazy.
So
I mean,
y'all
come on.
crazy, but he's crazy.
This poor child's got to live with me. You know what I mean? You know, she now she has a husband and 2 children, and she's got Nicholas and Lynn, and then her other child is Ryan. So it's you know,
yeah,
it's kind of funny, isn't it? So anyway, I wanted to have her on because, as I said, she's going to start seeing patients in the next couple of weeks. She's actually going to work out of Saudi Daisy. You're going to be doing more telehealth than anything else, telecounseling, rather than face-to-face, which is great because a lot of people are busy. You know, I thought that was really funny when we were talking about like doing like telehealth and things like that. You could literally do that driving in your car.
You could, but
yeah, I mean, not you, but I mean, the client could actually be in the car and talk to you. I mean, it wouldn't be a great idea to be like,
but it's basically pull over or have somebody drive.
It's like don't what's this? Don't have therapy and drive. It's a kind of a cool thing. You know, we were talking about kind of adding in some telehealth into the office because there's certain times where, I'll give you a good example. Medicare does not allow me to refer out to x-rays and PT and all that. It's kind of weird. So what we're trying to do is we're trying to get telehealth in there so they can see my patients and order all of that stuff. You know, with you know, somebody can come into my office and I can refer to you. Like, people have issues. I mean, we've been having, after COVID, I mean, I think we have a lot of issues.
Yeah.
Now, you did play therapy for a while where you were working before.
Yeah.
Tell me a little bit about play therapy.
Yeah, so play therapy is basically getting to play with littles or kiddos, usually around the age of 3 and up. I mean, I think everybody's a big kid. And basically, you're just letting them lead, and play is their language. So typically, if you're just letting the kiddo pick what they want, they'll just lead the session. So some of them might want to do aggressive play if they need to like act something out, or maybe they're wanting to do like an art for the session, and maybe they've had like a hard holiday, you know, since we just had Thanksgiving, or a lot of the kiddos were drawn to, you know, playing with the dollhouse and maybe trying to recreate something maybe that happened in the home. So play therapy is basically letting a child use play as their language.
When I was a kid, my parents got divorced when I was young. When I would go see my father, my mother would turn around and say, he was a bear for 3 days. I mean, that was. There's traumatic issues that occur with that, but
like
I think
you were.
Yeah, me personally. Yeah, I was a bear.
Yeah.
She said that I could not even out for like 3 days.
Yeah,
it was like because there was so much angst that I was going through. And I guess if I had play therapy, or if it was one of those things back then, I probably would have been in therapy for sure.
Yeah.
And I'm a big therapy guy, right?
Yeah.
I love therapy.
I hope so.
Yeah. Well, but you understand, if it wasn't for therapy, I would not have become a doctor.
Yeah.
I told you that story. It's like, I was warring between two personalities. I wasn't schizophrenic, but I was warring between these two personalities that I was trying to come to grips with. And I realized where I really wanted to be was here. And I felt I wasn't good enough to be there. And then lo and behold, we're here today. But there's nothing wrong with therapy. People have this thing in their head that therapy's bad. Oh, we don't want to go to therapy. I don't want to talk to anybody about my problems.
Yeah.
But once they get there, it's like, you can't shut them up. It's like, come on. Why is it that people are afraid of therapy? I mean, seriously, what do you think the reason is?
Well, I mean, like you were just saying, there's such a stigma around therapy. It's like, oh my gosh, you're going to see somebody, like your shirt says, y'all crazy. Yeah. But, like you're saying, sometimes with certain families, what we talk about needs to stay in here, right? We don't want somebody going out of the home and talking about, like, this is our stuff. Like, nobody needs to know what's going on in here. And so sometimes that carries on with the kiddos, and they feel like that's a burden for them to carry. Or then there's other people who are like, oh, that doesn't work. Or I know somebody that went to see somebody and they didn't have a good experience. Or, hey, that's really expensive. I can't afford that. Or, people say, well, shop therapy, like retail therapy, or something that's least expensive than going to see someone, like going out to eat or drinking or substance abuse. I mean, there's other things.
There's so much with that self-medication. That could be a whole nother show in itself. We're talking about, mental health. Danielle's a marriage and family therapist. Now, I will have to correct this. I affectionately call her Danielle, but it's Ryan Miller. So we're not going to just talk about marriage and family therapy. We're just going to talk about just really therapy, and because you've been working with little kids. And now, one of the things I thought was really interesting was that you want to kind of move into a different realm, because, play therapy is very important. It's not like you're not going to do that, but you want to work with patients with postpartum.
Yeah.
And I think I can't relate to that at all, because there is no way that I would ever have that. But you have dealt with some of that. Yeah. So not only are you wanting to help these women, but you really know from a personal experience, which makes a huge difference. Mm-hmm. Yeah, it's like me telling somebody about headaches. Like, oh, I've never had a headache before. Well, I've had headaches before, so we can relate, and that makes it so much more relatable. So tell us a little bit about postpartum. There's guys looking at this.
Yeah.
And they're sitting there going, my wife, y'all crazy, but there really is some truth to that.
Yeah.
Give us some information about what postpartum is, that women know what it is. They know what that is. But as other people, it's not, you can't touch it. It's not a broken bone. It's not a cut. It's something you can't see, but yet it really affects people drastically.
Yeah. So if we're just talking about postpartum, we're talking about, after you have a baby. And usually that looks like about 6 months or so. There could be postpartum depression, postpartum anxiety. It could be a combination. So it really just depends on maybe what symptoms you're having. So postpartum, that's kind of just like very vague. So postpartum is just really after having the baby. So everybody thinks, okay, you're pregnant, you do the prenatal care, and then you have the baby, and then that's it, right? Like, you have the baby, and you're a mom, a parent, and, that's it. People don't really talk about that next trimester, right? There's 3 trimesters. And so people don't really think that there's a 4th trimester, and there is. And so sometimes when things are a little heavy, we don't want to talk about it, right? Because like we were saying before, what happens in the house stays in the house. We don't want anybody getting into our business. But this is really important that we bring to light that these things happen for women after they have a baby. So I guess we could talk about maybe like baby blues, right? So postpartum, I think a lot of people have affectionately called it the baby blues. And so it's more of like a very soft look at postpartum depression, because they're like, oh, she's just crying. She just had a baby.
If my wife is crying all the time, like there's something not right here.
Yeah.
And most men, and I'm not saying that guys, sorry about this, but most men just like, I'm not dealing with this. I'm out of here. I'm gonna go play golf. I'm going hunting. I'm gonna do something. And that's what happened. And that, I guess, would make it worse for the mom.
Yeah. And and just while I'm thinking about it too, I still have baby brain. I just gave birth 9 months ago to my beautiful second baby boy. So I still have baby brain. But postpartum depression and anxiety can happen for the dad too. It happens for men as well, and it's like, what? That's weird. But they are going through all these changes with you, right? And so unfortunately our society, it's like men just really, we like you to show one emotion, if that, and that's anger, but then we get mad that you're showing that frustration. So men can struggle with this too, because they're like, where's my wife, right? Especially if it's your first child, because then they're like, whoa, what's happened? But as far as talking about this, it's pulled on my heartstrings a little bit more after having Lynn, just because there's such an age gap between Nicholas and Lynn. It's 5.5 years, and there's still really no progress or movement in this area to talk about what does care look like for women, for moms. Does that make sense?
Yeah, it's funny you should say that. There is a huge difference, not huge, but I mean the 5.5 years between Nicholas and Lynn. So, like when Nicholas was born, it was a lot easier to deal with, I guess. You felt that you could deal with it. But when Lynn came and you're trying to juggle 2 kids,
that's a lot.
Yeah, does that happen a lot though? It's like, or does it happen like even with the first child? Is it worse with the second child, or is it better in some cases?
Yeah, it just depends on the person. For me personally, I think that I did deal with postpartum depression and anxiety the first time, but I hid it really well. Or you think it's really, you think this is normal, right? I mean, if you're not worrying or caring about your kid and checking the crib every few minutes to check if they're breathing, like you feel like you're not doing your job. But then when it gets to be where you're not sleeping at all, which, I mean, who sleeps with a newborn? But, it's one of those things where you come to realize, like, this isn't normal.
I'm thinking about this now. When you first mentioned it to me that you were going to deal with women who have just given birth and gone and have this postpartum blues or anxiety or whatever it is, I thought, wow, I never thought of it as being that much of an issue until you and I talked about it after you had Lynn. And I thought, wow, that's awesome. Where are they going to go? And it's probably one of those things where people don't have a place to go. Like it's, you don't go through we talked about the phone book, and that's funny. Yeah. You don't go through Google and look for, postpartum counselors. I don't even think you would see that, would you?
You can actually Google, and there are providers that, specialize in that care. For me, when I, felt like, hey, I need some help here. I was already having therapy. Therapists have therapists, just so you know. But for me, I reached out to my midwife. So instead of having an OB, I have a midwife, and she is awesome. Shout out to Meg Brazel. She is wonderful. But she met me exactly where I was. And her nurse, Erica, shout out to her, they just know that's just what they do, right? And so typically for a mom after giving birth, the first 2 weeks, she's supposed to recoup, right? She just gave birth, whether it's via C-section or, vaginally. And for the first 2 weeks, they're supposed to rest. You're not supposed to drive anywhere. You're not supposed to lift heavy things. I mean, hello. Your first 2 weeks, you've got to take that baby somewhere. You got to take him to the doctor. And then you have other appointments that you have to go to, or if you're trying to breastfeed, a lactation consultant, because, hey, breastfeeding is hard. So you have all these appointments that you have to do, but then you're supposed to be, taking care of yourself. When does that happen? So it's like you have to have a village. So I guess what I'm trying to say is everything still falls on mom. Then the mom is like, what am I supposed to do? And so I just feel like there's a need. There's always been a need. But for me, I feel like God's moving me into a season of helping other moms. Because, if you're complaining about being a mom, well, at least you got pregnant and you had a baby. Like, this is supposed to be blissful. So you have all this shame and guilt of feeling like, oh my gosh, what am I to do? But how many times have you heard, and we said this the other day, about kids being born and you're like, where's the handbook? Like, yeah. I don't know how to raise a kid. And people think, well, that's just supposed to be natural. And there's a few things that come naturally, but then, you're usually, learning from your friends, your mom, your dad, your grandparents, those spiritual people in your life, maybe from church or other areas. So I feel like I'm rambling here.
No, it helps. It makes a lot of sense, because not knowing that, being your dad and watching you, and it's like, whatever you need, like, we'll come get him. Like, mm-hmm. Just call us and we'll come get him. One of the things is in the 6 weeks. Mm-hmm. That's kind of that crucial point. What happens at that point? I don't know what's going on, because we don't go to those checkups. Yeah. So, when you're talking about Megan, they know what's going on. Mm-hmm. So what do they do? Like, how do they check you? What do they do?
Well, yeah, they do check you.
Well, no, I meant
they're checking you physically, but also emotionally, mentally, they're checking in. And that's one thing I forgot to say, because I started, rambling.
No, you did great.
But, when you're taking that precious newborn for their first doctor's visit, it's very exciting, because getting to check the weight, trying to make sure they didn't fall below too much, and how long are they already, and all the things. But what they do for the mom is they usually give you a screener. And so you'll fill it out like a depression scale, and, they'll kind of tally it up and see what's going on. So you'll do that there. And, if you have some problems, the pediatrician will talk to you and check in and see how you're doing. But if we're going back to what you were saying, like the OB, the 6-week check, of course, they're going to be doing some screeners there too and checking in.
Does a pediatrician do screeners for you too?
Mm-hmm.
Really?
Yeah.
Hey, I learned something new.
Yeah.
Yeah. I guess that would be a great place to go, because you're going to go see the pediatrician for the baby.
Yeah.
So they want to check mommy too.
Right.
Oh, that makes sense.
Yeah. Thankfully for me, having Lynn going in there the second time, I had a great relationship with Dr. Carolyn Brannon at Galen North Pediatrics. Shout out to them. They're wonderful over there.
How come you're not on the show?
But, with Dr. Brannon, honestly, we just clicked after I had Nicholas. She came into the hospital. It was actually supposed to be another provider that came and was going to be Nicholas's pediatrician. And she was actually filling in for this doctor. And I asked her, we just clicked, and I asked her, can you be his doctor? And she was like, yeah. And so that just happened organically, and we just clicked. And so I feel like with her, she really listens to me. And so building that rapport was good for me. That way I knew I could talk to her. But if you're a new mom, I see it a lot on Facebook, new moms will say, what pediatrician do you recommend? And they're just going by what other people say. So if you're a new mom, first mom going in with your baby, you might feel a little intimidated to say anything to the pediatrician, right? And then when you know that you're doing the screener, you have to be 100% honest with yourself, and that's really scary, to be 100% real and raw with yourself, and then with somebody else that you don't know, because you have your baby, because then you're like, are they going to take my baby away from me?
Yeah, I was just thinking the same thing. It's like, there are you hear women get these crazy thoughts if they have a baby.
Oh, yeah.
And yeah, I would be, first thing you said before, as you're talking, I'm thinking, I'd be afraid to say something because they take my baby. You say you want to smack your child and they want to take the child. So it's like,
Yeah.
I know it sounds funny, but it's true.
And let's just say this too, because Dad is being really funny and using the word crazy, and we all say oh, you're crazy, or y'all are crazy.
Nobody's crazy.
And when you said crazy thoughts, let's just let our people know, if anybody's listening to us, if anybody's watching us, that your thoughts are not crazy. Okay, like in your head, you may be like, "That's crazy," and I know that you weren't trying to be like.
I know exactly.
But we are
scolding me.
We're very sensitive. We're very sensitive about your thoughts and your feelings, and you know what those thoughts are, right? So they're not crazy, but you know,
but they may be to that person. But that's what I'm saying,
right? And I get that. I just wanted to clarify that,
and I totally get that.
Yeah.
This, you know. When you're going through this, you have to be very empathetic, and I am. I know we're going through, but it's the truth. It's like I feel for these women because it's like, what do you do?
Mm-hmm.
You know, and I'm just going to say it, but you know, what about like unwed mothers and they're raising these children by themselves?
Mm-hmm.
How hard is that going to be? You know, so it's not, you know, not saying that that's it's just that it happens.
Yeah, it's just hard. Like, just being a parent is hard. And when you don't have your village, you know, it can feel very lonely. And so that is why my heartstrings are being pulled so much, not just because of me going through postpartum depression and anxiety, but, you know, just knowing that if somebody feels alone, I don't want anybody to feel alone. I mean, ultimately we all do, right? But as far as this season is concerned, I feel just more passionate, more focused. I don't know. I just feel like it's something that we need to talk about, probably because of my own experience, right? Like,
but it affected you so much. You know, I am so proud of this girl. I just got to tell you that. You know, I can't say it enough. I mean, you know, I tell everybody how proud I am of you. But I've watched, you know, you've literally going through college and then end up becoming, you know, a therapist and how good you are at it. Like I've had people tell me how good you are, and it's like, boy, that just does Dad's heart good. Oh, yeah, I love that. But I know you are, and as you get into this, and when you told me that you're going to go out on your own, it's like, okay, how can we do this?
Yeah.
How can we get you to, you know, let's get you a place, let's get you things to do, let's get this all started, because God has given you such a gift to talk to these people and literally have this just rapport where people just go, oh, thank you so much. I mean, and it's amazing what you do. I mean, just when people meet you, they just feel comfortable. And I don't say that. It's the truth. Don't go like, no, it's the truth.
You're way too kind.
No. It's the truth. Not because you're my
But
therapist.
it is an honor. It is an honor to be able to walk alongside people, listen to them, cry with them, pray with them, listen to them, help pick up the pieces, try to figure out what can we do to help you live your best life, right? And that's why you do your show, right?
Absolutely. Yeah. And I do, and this is important to me to get people to understand what's going on and where we're going with all of this. But what's really interesting is that when, you know, you have a servant's heart with this, and that's just God all over that. I mean, what you do is what you do, but you do it because God's given you this gift, you know, and that's where all that power comes from. It's like I can't do anything on my own. I just can't. But if it wasn't for the grace of God, I wouldn't be able to do what I'm doing. I wouldn't be able to talk with people. You know, I wouldn't have the opportunities that I've had. And now I'm watching you do those same things because God is working through you. And that's important. I know people are going, oh, he's talking about God. But you know what? We have to, because that's where our strength comes from. That's where our power comes from. And what you're going to do when you meet with these people is, whether or not they want you to pray, you're going to pray. I mean, I know you. You know, you're going to do that, and that's why God is going to bless that. And whoever sees you, regardless of how they feel or how they believe, God's still going to bless them, because God's working through you. You're not working by yourself, and that's really important. It just is. And I mean, I'm saying that sincerely. So, you know, I appreciate that. And I'm excited that you're getting to do this. So we have a number that they can call.
Yeah. So
you found it.
I found my new number. Okay. So my number is 423-451-6898.
Now, I will say this. It's going to go in podcast. If you guys go into Health Chat, any podcast platform there is, the shows will be there. And we're going to be talking about this. You know, I'm going to have Danielle come on a lot more with me. Eventually, she's going to take over the show. As I want to go to the Bahamas, and my wife's going to get a little Speedo. No, I get the Speedo. She gets the string bikini. And then but no, in all seriousness, you can get the shows, and you can listen to the shows. So don't stress out if you want to call, but you can always listen to them, and you can always give us a call. And I'll put those in the descriptions where you can get a hold of you, where you can get a hold of me.
Yeah.
So it's in there.
Or
So
if they don't even want to use that number, they can call the office too.
Oh, heck no. I'm not your secretary.
No, stop. Shay is great.
Yeah.
You know, we've done this before.
We used to be part of my practice.
Yeah.
Now we've decided that, well, I want you to have your own practice. So you have your own practice. And what's it called?
Yeah, so it's really exciting. So it's going to be called Lotus Counseling Services. Lotus represents, purity, strength, rebirth, just beautiful adjectives. And, it also means my son's name, Lian, the whole meaning for my son's name, Lian, is that God answers prayers. And so I believe that he is an answered prayer, and it continues to remind me how good God has been. But also in other cultures, his name means lotus. And so he has just helped me with this season. And of course, my firstborn Nicholas, oh my goodness, he's helped me so much to learn, like, there's not a perfect parent, and you cannot perfectly parent. It's imperfect.
Now, you do realize, folks, that when Nicholas gets bad, I get to blame.
He gets to blame because Nicholas is named after Dad. So anytime that Nicholas is doing something, I'm like, oh, great, that's the namesake.
He calls me up. He's doing it again.
Yeah.
You've been listening to Health Chat. We have Ryan Miller with us. Give your number out real quick.
Yeah, 423-451-6898.
And you can always call me at 423-855-7376. We love you guys. Have a great week, and we'll see you next week.